So welcome everyone. Thank you for joining our webinar. Dr. Selina Ahn will be giving our presentation today. She is a field application specialist of IVIM Technology. Her presentation will be on the in vivo applications in various organs. During the webinar, if you have any questions, please text it in the Q&A box. Your questions will be answered at the end of the presentation. Dr. Ahn, please go ahead.
Thank you for introducing me, Kubra. Hi, this is Selina. I'm an application specialist in IVIM Technology. And thanks again for your kind interest to our intravital imaging technology. So today, I will briefly introduce our technology and in vivo applications on various organ imaging in human disease mouse models using IVIM platform. Firstly, I'd like to introduce IVIM's intravital microscopy to observe live tissue and cell in the live animal. Compared to the conventional imaging technology, which only provides tissue-level information, the intravital microscopy can directly observe the dynamic cell movement in the internal organ of the live animal model for human disease. And in this example video shows how red neutrophils inside of the blood vessels forms a cluster and block the green blood circulations in the lung of the sepsis mouse model. And in vivo microscopy can provide a detailed live video of the disease development in cell level. Conventionally, for in vivo experiments, users have to prepare each required functions by themselves. There was a high degree of the technical difficulty and non-optimized performance with limited applications to the imaging interest organs. So it was very difficult and it's not an optimal solution with low performance without any standardized in vivo protocols. So IVIM's all-in-one intravital and confocal two-photon microscopy system is extensively optimized and carefully engineered to provide the best performance in the intravital imaging of the live animal models in vivo. IVIM's intravital microscopy enables 3D cell-level microscopic imaging and analysis in vivo. It successfully achieves a dynamic intravital cell life imaging, such as real-time cell trafficking and cell-to-cell interaction, cell-to-microenvironment interaction inside of the living body. And furthermore, it can be widely applied to the therapeutic research fields, investigating the drug delivery to the target tissue and drug efficacy and therapeutic mode of action in various preclinical mouse models of the human disease. Our company is the only one company in the world providing all-in-one intravital system with the best in vivo imaging performance. This all-in-one single box package enables easy installation, operation, and maintenance. It has co-optimized hardware and software for the best intravital imaging performance with the ultra-fast imaging speed, which is up to 100 frames per second. Thereby, we can even capture the fast dynamics, such as the red blood cells that are flowing inside of the blood vessels. And together with the automatic motion compensation function, we can compensate the vital movement of the target organ in the live animal. Thereby, we can get the high quality in vivo image instantly in the IVIM Studio software. And the system is integrated with the various accessories, such as live animal maintenance system for maintaining a healthy physiological condition of the mouse model. And it's also equipped with various imaging window chambers for wide range long-term in vivo imaging applications. Thereby, users easily can get the best quality in vivo data without any limitation in imaging live organs. And this is the newly launched dual mode in vivo confocal and two-photon microscopy, which is IVIM CMA3. And it is the most compact and affordable in vivo confocal and two-photon microscopy in the market, providing the versatile functionality in the single box. With the confocal laser and the compact 2-photon laser unit with one switch mode changing features, IVIM CMS3 provides a comfortable multipurpose use for in vivo functional imaging and saves from unnecessary space and high cost. And with 2-photon intravital imaging mode, we can easily acquire the high quality in vivo imaging of various tissues as shown here: adipose tissue, skeletal muscle, lung, and ear skin. Especially 2-photon microscopy can acquire the label-free second harmonic generation signals from the collagen structure as shown in the ear skin image, and microtubules in the muscles, and regular protein fibers in vivo. Also, it has wide applications on various imaging organs, including lymph node, thyroid gland, kidney, heart, and so on, with the best imaging quality in vivo. And also for applications, we have a lot of research publications according to the interest organ and disease models. And here the example of the in vivo imaging of the lymph node and lung of the sepsis model, bone marrow of the bone marrow transplantation mouse model, and skin validating the inflammatory effects of the drug candidates. And in terms of tumor, it can be widely applied to the cancer xenograft model, investigating the cell-to-cell interaction of the T cell and tumor cells in vivo, and the cancer metastasis model, analyzing circulating tumor cells flowing through the blood vessels. And we can perform imaging analysis of the in vivo drug delivery effects to the tumor tissue. IVIM's intravital microscopy has succeeded in high-quality live cell imaging in almost all of the internal organs in a live mouse model, as you can see in this slide. It includes brain tumor, skin, and pancreas, spleen, and some GI tracts, prostate, lymph node, memory tissue, placenta, and even heart and retina in vivo. From this slide, I'd like to discuss experimental methods of the animal manipulations for in vivo imaging of various organs using IVIM system. The first topic is ear skin imaging. The ear skin is the most easiest organ to visualize without additional surgical procedures. Firstly, we anesthetize the mouse by IP injection of the ketamine and xylazine cocktail mixture. And before imaging, the blood vessels were fluorescently labeled by intravenous injection of anti-CD31, the PCAM monoclonal antibody conjugated with a fluorophore, or various fluorescent dyes such as FITC, TriTC, rhodamin B was injected via tail vein or in vivo labeling. So here, TriTC dye was intravenously injected to the mouse model through the tail vein injection. And then after injecting the dye, the imaging area of the ear skin was shaved with the hair removal cream for preventing visualization of high autofluorescence signals expressing from the hair. So apply the cream evenly to fully cover the hair on the ear skin. And after a few minutes, about 3 to 4 minutes later, gently remove the cream and clean it with the saline. Then the mouse model is mounted on the IVIM stage with the heating plate and apply saline on the surface of the ear skin imaging area. Then cover with the cover slip. And then we place the ear skin in the middle of the cover glass and preventing the air bubbles to be captured in the imaging field. So we make the imaging tissue fully attached to the cover slip. And mounting the imaging organ like this. After mounting, Then we drop the distilled water on cover slip for immersing objective lens. And with the rectal probe for sensing the body core temperature, which has a feedback system with the stage heating plate, and the mouse body core temperature is well maintained at 36 degrees during the whole imaging time. Then place the imaging area in the middle of the objective lens using stage controller, and adjust the focal distance by minimizing the distance between the specimen and the objective lens using a stage jog. And then close the door for preventing light from outside. Using this ear skin imaging method, we successfully visualized the immune cell dynamics in the skin of lysem GFP transgenic mouse together with the ear skin blood vessels labeled by IV injection of the PCAM antibody, which is conjugated with the fluorophore. And in the result, we could visualize the cell-to-cell dynamics of the neutrophils in the skin. And even we can see the very fast dynamics of the flowing neutrophil cells through the blood vessels. And this is another research example utilizing in vivo ear skin imaging technique. And in this research, we successfully validate in vivo drug efficacy of the CARS protein, one of the secreted amino acid tRNA synthetase. So to investigate the details of how these enzymes induces inflammatory responses in vivo, we monitor the immune cell dynamics after the intradermal injection of this CARS protein to the ear skin tissue. So time-lapse intravital imaging showed the active recruitment of the macrophage and monocytes to the injected KRAS, which finally enables in vivo analysis of inflammatory effects of the therapeutic material. For immunology research, we can directly monitor the immune cell dynamics in popliteal lymph node. We adaptively transferred T cells and B cells, which are obtained from the actin DS rat and GFP transgenic mouse. And we monitor the extravasation dynamics of the T and B cells in high endothelial venule of the lymph node in real time. So here, T and B cells are selectively extravasated through the specific spots of the HEV. And to monitor the stepwise transmigration process of the T cells, we performed the in vivo 4D imaging of the T cell migration across the high endothelial venule. It clearly shows the multiple steps of the T cell migration across the HEV, which is composed of the endothelial cells and fibroreticular cells through the perivascular channel, which is adhesion to the ECs, and intraluminal crawling, trans-EC migration, intra-PVC crawling, and trans-FRC migration, and finally arriving at the lymph node parenchyma of the T cells. And moreover, long-term monitoring of the endogenous T cells and B cells migration clearly shows the existence of the trans-EC and trans-FRC migration hotspots in HEVs. And furthermore, trans-FRC migration of the T and B cells preferentially occurred at FRCs, which were covered by the dendritic cells in HEVs. And these results suggest that high endothelial venule and endothelial cell and fibroreticular cells with the perivascular dendritic cells delicately regulate T and B cells entry into the peripheral lymph node. And for in vivo lung imaging, we utilize the thoracic window chamber, make the mouse breathe by the intubation, which is connected to the artificial respiration system. So after that, we remove the ribs to expose the lung tissue, then attach the tissue with the lung imaging window chamber, which is connected to the vacuum pump for stable visualization. Then when we start the lung imaging, then with the motion compensation function, we can get this clear and high resolution image of the lung, which is visualizing the neutrophils and blood flow dynamics simultaneously in real time. This is the stabilized lung imaging window system, which is the suction-based system we developed for in vivo lung imaging. The chamber has a suction hole at the bottom plate to let imaging tissue to be attached to the cover slip with the slight negative pressure applied in the inside of the imaging chamber. And utilizing this intravital lung imaging platform with the stabilized lung window chamber, we can acquire the high quality real-time microcirculation movie of red blood cell microcirculations in the pulmonary vasculatures. And this is one of in vivo imaging example we acquired from the healthy mouse model. So we utilize type 2 GFP mouse model to visualize the vasculature. And for RBC flow analysis, we adaptively transport red blood cells, which are selectively labeled with the DID dye. And we've acquired a real-time movie of pulmonary microcirculation in 30 frames per second, and then processed for frame averaging and motion compensation for vasculature. And then we perform video overlay with the RBC signals. Then we can get the high quality real-time video of the pulmonary microcirculation, and we can measure the RBC flow rate with the cell trafficking functions also. And in the disease model, after sepsis induction by injecting LPS, pulmonary neutrophils migrated to the specific sites and blocked the microcirculation of the lung blood vessels. And we can finally acquire the real-time quantitative analysis of the blood flow, distinguish the functional capillaries, and analyze the vascular area specific velocity in pulmonary microvasculatures in the sepsis mouse model. And for liver imaging, we slightly incise the abdominal skin and the peristome to access the liver tissue, and gently take the organ tissue slightly out of the body and mounting the liver with the cover slip. And this is the research examples of the nanoparticle delivery and accumulation in the liver sinusoid captured by the real-time video. The red nanoparticles were delivered in the liver sinusoid right after injection via tail vein catheter. And then we can see the accumulated to the specific size of the liver sinusoid a long time. And when we apply to the fatty liver disease mouse model, we can clearly visualize the fibrotic collagen and the lipid drumlet in the liver tissue. Especially fibrogenic collagen can be visualized with the label-free second harmonic generation signals in the two-photon microscopy. And also here's the imaging result of the monitoring the development of the hepatic lipid drumlets in the failed mouse model, visualizing the disease development over time. And the number of the lipid drumlets accumulated in the hepatocytes increased over 3 weeks in the liver disease mouse models. And we also performed the quantitative analysis of the lipid drumlet size and the area located near the various type of the hepatic vessels, including portal vein, periportal, and sinusoidal vessels. In the result, the size and the area of the lipid drumlets increases from portal vein to the sinusoid area. And in the steatosis disease model, which were induced with 27 weeks of high-fat diet, the hepatic lipid drumlets and the fibrotic collagens were accumulated in the hepatic tissues. Especially the significant collagen deposition in the liver stroma, which is liver fibrosis, was successfully visualized by label-free second harmonic generation signals. The magnified 3D rendered images, the distinctive subcellular level histopathological features of advanced NAFLD, such as accumulation of the lipid droplets in the hepatocytes, and also perisinusoidal deposition of the collagen fibers were clearly identifiable. Furthermore, we could precisely quantify the volumetric proportions which were occupied by the hepatic lipid droplets and collagen fibers in the liver tissue in vivo. For in vivo long-term monitoring, we utilized the imaging window chambers such as dorsal Skinfold chamber for in vivo analysis of the cancer or drug candidates, and cranial imaging window for brain imaging, and abdominal imaging window for imaging internal organs. And this is the surgical procedures for dorsal Skinfold chamber mouse model. We implant the window chamber on the dorsal skin and clip the 3 sides of the chamber, then fix the screws in both sides of the skin tissue. And then after finishing fixing the screws, we make the sutures. And then we remove the one side of the skin tissue and subcutaneously inject the tumor cells in the other side of the skin tissue. Inject the tumor cells like this and cover with the cover slip and fix it. And then we mount it with the window holder on the stage. And when we visualize it, we can finally perform repetitive in vivo imaging of the tumor development and in vivo analysis of the target drug delivery in the tumor tissue. So therefore, in vivo cell analysis of the angiogenesis and vessel dilation and blood flow using labeled RBC were successfully acquired. And with an imaging technique utilizing dorsal Skinfold chamber, we can perform the repetitive and in vivo imaging of the tumor development or in vivo analysis of the target drug delivery to the tumor tissue. So we firstly implant the tumor cells and monitor the development of the tumor on the site. And the result shows the tumor growth with the newly generated vascular angiogenesis within 4 days after tumor implantations. And for in vivo drug testing, we've generated 2 tumor mouse models with the dorsal Skinfold chamber. So one with anti-angiogenic drug treated, while the other group was treated with cell line. And then we visualize the tumor cells together with the blood vessels. Then we can analyze the drug's anti-angiogenic effects on the tumor vasculatures. And the result shows that the tumor vessels are less dilated in the drug-treated group compared to the normal control group. And in the wide area, after drug treatment, vessel morphology became more normalized, that is less dilated and less branched compared to the sham control model. And thereby, in this way, we can finally validate the in vivo efficacy of the anti-angiogenic drugs on the tumor tissue. And this is another example investigating the nanoparticle drug delivery to the breast cancer cells. The GFP-expressing breast cancer cells were implanted and grown 4 days after drug testing. And then we treated nanoparticle drugs to analyze the drug delivery and distribution to the target breast cancers. And long-term monitoring over 24 hours revealed that successful nanoparticle delivery to the tumors through the blood vessels and relatively uniform distribution of the drugs in the target tumor tissues. For longitudinal in vivo imaging of the brain, we utilize a cranial imaging window. So we implanted the cranial imaging window chamber using the dental cement on the cranial bone as in this picture. And for cranial imaging window, we firstly make a scalp skin incision and remove the periosteum with a sterile ear tips and scrub the surface on the skull and make a circular groove in the skull with the drill. and remove the excised bone flap. And then we cover with the cover slip and apply the UV curable adhesive to nearly dry skull and seal the optical window with the dental cement, covering all the exposed skull. And place the mouse model on the heating stage. Adjust the focal distance between the specimen and objective lens. And cranial imaging window imaging technique can be applied to the brain tumor imaging research. So we've implanted the glioma cells to the brain and monitor the tumor development in the same brain imaging area in the same mouse model over 15 days. And the number of glioma cells increased with the round cell morphology over the days after tumor implantations. And this is the research example monitoring the brain neuroinflammatory responses, which were induced by the 3-MT chemical injection. So after induction, lysine positive leukocytes are getting densely located to the specific size of the cerebral cortex within 10 days after inflammatory induction. And also from the time-lapse imaging, we could visualize and analyze the meandering and crawling behaviors of the lysine positive neutrophils in the brain of the neuroinflammatory mouse models. Then we longitudinally observed the BBB integrity through a 30-day of the neuroinflammation status. And we can see the vascular leakages in the cerebral cortex were observed to the 3rd week, and followed by a severe inflammatory responses with the massive leukocyte infiltration at day 30, which is reflecting a BBB impairment. And to investigate the cell level alteration following microinfarction, we performed a long-term repetitive in vivo imaging of the cerebral cortex for 30 days after photothrombosis in the live animal model implanted with the cranial imaging window. So by utilizing double transgenic mouse of a parasite reporter, which is NG2DS rat, and the astrocyte reporter ALDH11 JFP, then we can simultaneously visualize astrocytes and parasite composing the neurovascular unit. And in the microinfarction model, the acute tissue expansion followed by a gradual tissue shrinkage was observed. The vascular map showed acute 1.5 volts expansion of the brain tissue, indicating a severe edema for 2 days, and then followed by a gradual shrinkage at day 5 to 8 days, and then a significant reduction of the brain tissue, which indicates a focal brain atrophy for 2 to 4 weeks after microinfarction induction. And to observe the cell level dynamics in the recovery of the parasite coverage, time-lapse intravital imaging of the NG2 positive parasites expressing JFP in their nuclei was performed for 24 hours, starting from 3 days after microinfarction. The proliferation of the parasites and the elongation along the vessels were clearly visualized, and then suggesting that the both processes of the proliferation and elongation processes contributed to the recovery of the parasite coverage from day 3 to day 5 after microinfarction. And to examine the impairment in the cerebrovascular perfusions and the leakage, a longitudinal imaging of the blood flow was performed for 5 days after infarction. The blood flow were visualized by IV injection of the different size of the dye, including like FITC and tri-TC dextran. So at day 3, only a leakage of the small size of the tri-TC dye were observed, which suggesting a compromised BBB integrity in the peri-infarct, which is causing a acute edema. And interestingly, the vascular leakage of the triacylidextran was not observed at day 5, suggesting an acute impairment and partial recovery of the vascular flow and leakage after the microinfarction. And for abdominal organs, we utilized abdominal imaging window for longitudinal in vivo monitoring of the internal organs, such as pancreas, spleen, and kidney. And this is the result of the spleen and pancreas imaging. We could visualize the real-time cell dynamics of the endogenous monocyte and dendritic cell in the spleen. And we can also visualize some pancreatic islet beta cells using the MIPGFP transgenic mouse. And the cell dynamics and the developments over the days were monitored in a long-term basis by utilizing those kind of abdominal imaging window. And also the tumor developments and anti-drug efficacy in the pancreatic cancer model with the PANC1 tumor cells can be analyzed in vivo in a long-term manner. In the kidney, after islet transplantation, we monitor the islet cell engraftment and the cell development in the kidney in a long-term manner. In addition, in a colorectal cancer model, we track the development of the cancer tissue in the cecum and changes in the microenvironment according to the treatment of the anti-cancer drugs in the same mouse model, together with the vascular changes. So again, intravital imaging can be a great method to monitor the temporal dynamics of the disease developments in the same mouse model over time. So IVIM technology has wide range experimental in vivo research application throughout almost all organs in the live animal model without any restriction of the imaging targets. So to summarize, IVIM technology is a total solution provider of the in vivo microscopy technology. So we are providing a unique all-in-one intravital microscopy system with the strong applicational support and high quality in vivo imaging research services for various academia research fields. And we have lots of in vivo research publications by using our system, which are categorized by their imaging organ and imaging purpose, such as red blood cell flow analysis and in vivo validation of the drug delivery and cell delivery. And this is the exemplary project I've been performed. In this work, we visualized the in vivo delivery of the exosome drugs to the target cell in the sepsis mouse model. So as you can see in this imaging result, the injected exosome arrived to the target cell only after 10 minutes and then became internalized after only 30 minutes. So thereby, if you have any inquiries according to your intravital experiments of your interest organ or tissue in your mouse model, so please free to contact us, and we can fully support you for the best intravital data. So that's just covered about everything I'd like to share today. So if you have any questions according to the in vivo applications using our system, so please feel free to ask them in the Q&A session. Thank you for your attention, and thanks again for having me today.